Hello and welcome to Everyday Medicine. I'm Dr. Luke and I'd like to thank you for joining me on this podcast series where we share conversations with colleagues exploring their special interests in medicine and bringing insights, ideas and advice which I hope will be applicable to our medical practices. In this podcast episode, we're talking with experts on the topic of medical cybercrime. But before starting, for Australian audiences, listening does give you eligibility for your CPD, so log in and add this as an activity. You may also consider journaling, reflection, and adding to the review and performance section in your CPD. Well, medical cybercrime refers to criminal activities involving cyber attacks on healthcare systems, devices, and data. These attacks can range from ransomware and data breaches to the exploitation of vulnerabilities in medical devices, posing serious threats to patient safety, data, privacy, and the stability of healthcare operations. According to the Office of the Australian Information Commissioner in 2023, the healthcare industry tops the list for cyber attacks. Healthcare became the most reported non-government sector for cybercrime incidents in the financial year 2023 to 2024, with more attacks than financial services, education, and other critical infrastructure industries, highlighting its vulnerability. Further, ransomware attacks targeting the Australian health sector are growing. Now, highlighting this point, 41% of healthcare organisations in Australia experienced a cyber attack in 2023. This marks a significant rise in the targeting of this critical sector, with a 71% year-on-year increase in global cyber attacks targeting healthcare organisations. 32% of healthcare cyber incidents involve compromised accounts or credentials. Others included malware infections at 17%, and 12% were compromised network infrastructure. Well, patients are also concerned, and in one survey, 82% of Australians indicated that they were worried about unauthorised access to personal health records and consider health information security when choosing healthcare providers. 33% said they were very to extremely worried about the security of their health information. In December 2022, Medibank, the Australian health insurance giant, was the victim of a major data breach affecting the personal details of 9.7 million customers. The attack was believed to be linked to a well-known ransomware group based in Russia, the Revel ransomware gang. $10 million ransom was not paid. Eastern Health, an operator of 4 Melbourne hospitals, subsequently fell victim to a cyber attack, causing certain elective surgeries to be postponed at the time. And another notable incident targeted Melbourne Heart Group. Well, reinforcing these concerns, tech giant Microsoft has also stated that the healthcare sector and aligned industries is one of the top targets for cyber criminals. Now, just to review, the types of medical cybercrime include ransomware attacks, and these are attacks where the attacks encrypt a healthcare organisation's data, demanding a ransom for its release, potentially disrupting critical services and delaying patient care. There are data breaches where cyber criminals may steal sensitive patient information, including medical records, financial data, and personal details for various malicious purposes. There's medical device exploitation. Vulnerabilities in connected medical devices such as pacemakers or insulin pumps can be exploited to compromise patient safety or disrupt treatment. There are supply chain attacks where cyber criminals may target the healthcare organisation's supply chain, compromising vendors or partners to gain access to the primary target. There are phishing attacks, P-H-I-S-H-I-N-G, phishing attacks. These attacks involve tricking individuals into revealing sensitive information or installing malware, often through deceptive emails or websites. Then there's social engineering, where attackers use psychological manipulation to gain access to systems or information. Well, the impact of medical cybercrime on patient safety, data, privacy, financial losses, operational disruptions, and erosion of trust cannot be overstated. I thought it was appropriate to raise this topic in our podcast. And so to explore and discuss this further, we're joined on this podcast by both Dave Vosnakes and Stephanie Way from the Australian Government National Office of Cybersecurity, who provide an expert overview of the growing problem. Please welcome them both to the podcast. Well, I'll thank Dave Vosnakes and Steph Way for joining me on Everyday Medicine. Thank you very much, where we're going to talk about cybersecurity as it applies to medical practices. And this is an area that I've been quite ignorant of. So I really appreciate you both making time this very early morning from a quite cool Canberra to come and talk with me. According to the Office of Australian Information Commissioner, in 2023, the healthcare industry tops the list for cyber attacks. And Microsoft has echoed this as the healthcare sector is one of the top targets for cybercrimes, as something that I was extremely ignorant of. So before we start talking about cybersecurity and how it applies to medicine, I wonder if I could ask you both, Dave Vosnakes and Steph Way, what is the National Office of Cybersecurity? That's like somebody from the dark arts, something that most of us don't quite know, these tendrils that reach out, protecting us all. We're not quite sure. Tell us about your jobs, could you both?
Yeah, thanks, Dr. Cransoft. So the National Office of Cybersecurity was created in, I think it was about 2022 or 2023, following two significant cyber attacks or cyber incidents that occurred in Australia that everybody be well aware of. That was the Optus breach and also the Medibank private breach. So again, as you say, health front and centre there with particularly the Medibank side of things. But I think some of the lessons learned that came out of those two particular incidents were the impact of the breaches across the two organisations, and the lack of coordination across government was probably one of the key things around the incidents. So what we found was both Optus and Medibank faced requests from all levels of government. I think they're trying to manage their cyber incident that's happening, and then you've got 400 government agencies coming in saying, we want to know information about what's happened. So one of the key lessons learned that came out of that was the establishment of the National Office of Cybersecurity and also the position of the National Cybersecurity Coordinator. And currently sitting in that position as the coordinator is Lieutenant General Michelle McGuinness. So one of the key roles of the coordinator is to help mitigate impacts of cyber incidents to impacted entities or organisations suffering cyber incidents or any attack of any form. The coordinator's role is also to drive whole of government response and preparedness uplift. So you'll hear, and we can go into it a little bit later, around probably the three key roles, I suppose, that we have in the uplift space: the cyber preparedness space and the incident response space. And obviously on the call today as well is Steph Way, who's the director of our incident response team. So kept quite busy. But yeah, we work with a number of government agencies, but I suppose between ourselves and Australian Signals Directorate, ASD, we'll go into that a little bit later. That's where we've sort of come from.
Right, I see. Do you have IT backgrounds or different sorts of management backgrounds? What was your path into this? I'm curious to know.
I did not have an IT background at all, actually. Probably the rudimentary, push the button on and you call the service desk and they'll tell you to restart your computer. But I think, Steph, what about you? Did you come in with the cyber knowledge?
Not at all. I did a little bit of work in a technology policy space within this department previously, but no, public servant by trade really here in Canberra, Dr. Luke. I think, as Dave said, a real body of work around better supporting companies that are experiencing these kinds of incidents, and this, particularly in that cybercrime space that we're seeing so frequently, and the ransomware and the data breaches. And so it's really about not necessarily needing to have that real technical background. Obviously, we've picked up a lot as we've gone along, but we work really closely with the technical teams within sort of the Australian Cybersecurity Centre, for example, within Australian Signals Directorate, to understand the more technical pieces. And our role is really about trying to help streamline that engagement across government and with government, and better support companies that are experiencing these incidents from a really holistic, coordinated standpoint, rather than necessarily providing technical advice. So that one's not our wheelhouse, but we help coordinate all the pieces together.
Okay, thank you. Well, I understand from my research that in 2023, 41% of healthcare organisations in Australia experienced a cyber attack, which surprised me as a number. Is that figure about right? Do you feel like, how common is it that we'll see cyber as it applies to healthcare organisations? How common is it?
I think it's incredibly common. From our position, we're probably not getting 100% of those incidents reported. So we know that there's a ton of incidents occurring, and they are deeply stressful situations for those companies and individuals to be dealing with and be involved in. And so there's a number of ways that people might approach managing that incident. And I guess we're not necessarily involved, obviously, in 100% of those, and they might not all be reported to government either. And so, again, that's part of our role is trying to help make that involvement with government a bit more approachable and make that something that companies are able to reach out and talk to us about. Engaging with us is entirely voluntary. We're not a regulator and we don't have a lot of sticks in our tool belt or anything like that. So engaging with us doesn't commit any company to a significantly prolonged engagement with us or any sort of ongoing arrangement if they just want to sound us out about an incident they're experiencing and try to learn about what kind of services across government they might be able to avail themselves of to assist in remediating that incident.
I see. Well, why is healthcare targeted?
I could take that one, Steph. I think there's a few different things here. Is obviously the highly sensitive personal nature of the information that's held. It's a sector that I think has had a lot of rapid uplift in sort of that critical research and technology space as well. The health sector is at the forefront of a lot of technology and research and trying to make the pathway through the health system easier for patients and practitioners to manage. And I think that obviously focuses the amount of data and the amount of information that's held across not necessarily just the patient's health records or the medical data, but the research information, all the identifiable information, details, intellectual property. So in a way, it's a catch-22, right? We've got to try and sort of make it easy to navigate the health sector. And then at the same time, we have these risks where cyber criminals and others are highly attracted to this data and this type of threat information, and that's what they actively go after.
Where are the threats coming from? Do we know? They seem to be outside of this country. Is that correct? I've heard that it's often from Russia and places like this. Do you have a sense of where these criminals are located?
Yeah, I mean, there's a lot of cybercriminal groups throughout the world, really. They're based all over the place. I don't think we would say it's any particular country. There is, like you said, there is a lot of open source reporting around there being groups in countries like Russia, but, they are really everywhere. We see criminal groups from everywhere, and those are, like Dave said, really unfortunately going after our most vulnerable systems, our most vulnerable services and individuals as well. So there's that dual victimization with this type of incidents where it's a crime, and unfortunately, like you said, they're often offshore, so it's not something that we do get a lot of arrests onshore for or anything like that. But that, notwithstanding that, there is still a lot that Australian law enforcement might be able to assist with international partners, so it's still worth engaging. And it is a crime and it is against the organisation, so there's that direct victim of the health organisation that's been impacted by that cybercrime incident. And then there's the victimisation of each individual whose data might have been impacted or breached or made public, which is obviously incredibly stressful for each individual as well in those circumstances.
Well, what do you think should be done if our practice was hacked, for example? There are lots of smaller metropolitan practices, not thinking now so much of chains like Eastern Health that was hacked some time ago, but thinking about smaller metropolitan practices. There might be a general practice with 8 to 10 GPs. If they think they've been hacked, what advice would you give?
Do you want to take that one, Voz? Do you want me to? Look, we would really strongly encourage that as soon as anyone is experiencing a cyber incident that you do report that to, there's reportcyber.gov, and there's also through that you can report to law enforcement for a investigation, because there's actually a really important piece of preservation of evidence to be done if there is a cybercrime incident. So obviously the first thing you're going to want to do is ensure that your technical teams are immediately assisting to try to secure your systems and eradicate any kind of threat actor that has infiltrated your systems. And it's an incredibly stressful thing for people to be involved in. But, there are a lot of companies that do support this type of work that are readily available at all hours to try to help and assist. And from a technical angle within government, there is the Australian Cybersecurity Centre within the Australian Signals Directorate, and they do provide technical advice and assistance to Australian businesses experiencing these types of incidents. So reporting it can really assist, because if there is, for example, a police investigation and it is cybercrime, then there is an important piece of work around preserving certain evidence so that police can follow the trail of what's occurred there. But you really want to make sure that you've got that technical team immediately onto it.
Yes.
To try to contain the threat.
So we call the technical team, your IT team, which we all have, and we go to reports cyber.
Report Cyber, that's the one.
.gov, and we explore the assistance that's available there. What if, and I don't quite know how these things actually become apparent to one, but I guess you get the black screen of death. It's like a scene from Black Mirror, something that comes across your screen trying to extort money. What if a ransom is extorted? If someone's saying, well, we won't give you your data back unless you pay us in Bitcoin, whatever. Well, I think the Bitcoin's just bottom dropping out Bitcoin by the sounds of it. So maybe some other cash is being requested. Again, you just go through the government agency. Do you have any advice about that? You want to get your information back and they're trying to extort money. What do you do then?
Yeah, look, unfortunately, paying a cybercriminal a ransom does in no way guarantee that they will in fact give your data back or not on-sell it and those types of things. So we can really understand why paying a ransom might be a really attractive option for companies. As you know, it's not illegal to pay a ransom, although there are, some complexities around that when it comes to sanctioned individuals and the like. But broadly speaking, it is not outlawed. However, we really strongly do not recommend paying the ransom. You really are just feeding that cybercrime business model. And if Australian targets pay the ransom, it actually makes Australia a more attractive target. So our recommendation is never to pay the ransom. But that said, we really understand the deeply stressful personal nature of these types of things when people are responding to them. So it's not a taboo subject for companies to talk to us about their considerations around the ransom and the demand and how they might be interacting with the threat actor themselves and, what their strategy might be for whether they're entertaining paying it or not. So it's not such a taboo subject, but people think it might be. We actually very recently mandatory ransom payment reporting has come into effect. So that is actually to just assist government in understanding the ransom payments that are being made from Australian businesses. Because if we don't understand the really broad economical impact of this type of cybercrime and the ransom payments that are being paid, then we cannot build policy around it. We can't better support companies experiencing these incidents. But we know that the cost of ransomware in Australia is monumental. And what we want to do is start understanding what that real cost to the economy is so that we can better create policy and frameworks around that ransomware issue and then better support companies experiencing it. At the moment, the mandatory reporting has come into effect, and what that means is that it is pretty much just received through a mailbox some details about the ransomware payment if it's made, and then a unique sort of case number is provided to the company that made that report. So Australian businesses with turnover threshold are required to report, and that information is just at the moment being collected. Later there'll be more of an enforcement approach to making sure that those reports are made. But at the moment, it's an education piece. It's just come into effect really recently. So that'll help with us understanding what it really looks like and how we can better assist with ransomware issues in the future. But look, we don't suggest paying it ever. We recommend working with law enforcement, talking with law enforcement. They've experienced these incidents, hundreds and hundreds of thousands of times. And when a company suddenly, like you said, finds that ransom note on their system, starts losing access to things, or data has been encrypted or stolen, it's really stressful. And it's often the first time it's happened to that company. So, lean on the expertise of the law enforcement bodies that have done this many, many times. They can provide advice and really help with understanding how these types of situations tend to evolve. Yeah.
That's extremely helpful, and it gives us, a sense of, I think, comfort to know that we do have the government agencies like having our back, if you like. I just wondered if there's a legal requirement for us to be able to protect our information. If there is a breach, is there a fine that we may have imposed upon us for a data breach? Do you know about
take that one, Voss? Yeah, so I wouldn't be able to speak to fines, Dr. Luke, I'm afraid, but there is a lot of work underway about the data retention requirements on companies. And I think, one of the best things that companies can do in the medical sector and small companies who, might not necessarily have the most technically engineered systems and have not invested all of their time and money into security, because you're busy dealing with patients and trying to provide services in the health sector. And so one of the best things that companies can do is really consider the storage of data, what, why, how, and for how long. So, if you're not needing to hold on to data, don't hold on to it. And obviously there's a lot of regulatory requirements for how things are managed. But if we can reduce having as much data sort of held in systems, then it will obviously significantly reduce what can be lost. And that includes things like ID documents. If they don't need to be stored, don't store them. There are reporting requirements for the Privacy Act. So Dave, do you want to talk about that bit?
Yeah,
Yes.
I was just going to quickly mention, obviously, as Steph said earlier, we're not a regulator in the National Office of Cybersecurity, but there are regulatory obligations that impacted entities do have to consider, and that can be separate to the cyber incident response piece. So obviously, hopefully people are aware that the notifiable data breach scheme as part of the Office of the Australian Information Commissioner, there are some requirements there. So it'd be worthwhile heading over to the Office of the Australian Information Commissioner website just to refresh on some of the parameters around those reporting requirements. Obviously, the OAIC is an independent regulatory body, and then across, I suppose, the medical and health sector, there will be definitely some other regulatory obligations at the state and territory level as well, I would suggest. But as Steph sort of said, I think one of the key things for us is making sure that you're taking all steps to secure your systems. So there's the Act Now Stay Secure campaign. At an individual level, there's 3 simple behaviours that I think everyone can adopt. And it's always sort of setting up and using that multi-factor authentication, making sure that that's an option and it is used. Using those unique and strong passphrases for every account. Don't have your password as password 1234, but have it as a unique, strong passphrase that you can sort of easily remember and individually, but still secures. And I think the key one is install all software updates as soon as they're available. I know with a lot of practices and other non-clinical spaces as well, you will use managed service providers to do all those sort of things. So ask the simple questions when you're looking at those managed service providers and other platforms for storage of information. Are they doing the simple things, and are there availability for multi-factor authentication, and are they doing software updates? There's some of the key sort of simple, easier things that can be done to help protect you. And then obviously, hopefully you don't end up in the situation where you are subject to a ransomware or lose any type of data.
That's very helpful. Thank you very much. Is cybercrime insurance something medical practices should be considering?
Yeah, I think so. As far as having been involved in some of the incidents that over the last few years where companies haven't always had that insurance, I think the insurance does provide a lot for those that do experience these incidents, and the absence of it is incredibly costly, which, we've seen companies that haven't been able to recover from the cost of a cyber incident, which is really incredibly unfortunate. And they are incredibly costly events. So, yeah, I think that cyber insurance is well worth considering, as is regular penetration testing and things like that. And broadly, we understand, it is a significant investment financially. And so companies have a real challenge trying to convince boards and the like to commit money in this space. And that is particularly challenging, but we can really see that, cyber is continuing to grow as an area. We've also seen, companies provide pro bono support for sort of non-for-profits and things in the health sector. So those kinds of, opportunities are out there if they are required, and smaller businesses can look for those types of opportunities and support if they need to.
Well, thank you very much. So I think just in summary, we need to protect ourselves and be very aware that this is a real threat. We have the Australian Government National Office of Cybersecurity. You've got our back. We've got the reporting systems that you've discussed that we should report cyber.gov. We should come to straight away if we do feel there's been a breach. We should probably do, as you mentioned, these sort of tests, like a penetration test, just to make sure that our systems are nice and secure, change our passwords, have complex passwords. And we appreciate very much, the government keeping us updated in this area. I have spoken to quite a few of my colleagues who are not really aware of this whole field. And we've all heard about attacks, and most recently Qantas was attacked. But I think there's still a degree of poor knowledge, if you like, from the medical practitioner perspective. We're very much focused on just seeing patients and not so much on protecting the data, which is, so important. So we really appreciate you both being there, making time this morning to have a talk with us. And, I think it's a space we'll be watching very closely going forward.
Yeah, I think, Dr. Luke, as well, you just made me think of something, but it's really, I think cyber itself can feel like a really intimidating topic for a lot of people, and people sort of immediately think, oh, I'm not technically minded. And that's where I think for all businesses, including every medical practice down to every receptionist or administrative support officer that assists on the front desks, there is a real body of education for everybody involved in your business. We're seeing more and more social engineering attacks and man-in-the-middle attacks. So that's where someone might call up pretending to be someone like an IT provider and then convince someone to give them login details or something, and that's how they get into your systems. Or with the changing of details on an invoice. So any red flags are when an invoice from a provider that you use regularly suddenly has different bank account details and things like that. So it's really, really important that every single person within your business is really mindful of not clicking on links that are sent in emails. And, we're seeing scam artists getting better and better and better with the quality of the phishing links and the types of emails that they'll send phishing links in. So it's really about that education piece across your entire organisation, down to the casual receptionist that might fill in one day, because it can just be that simple and that quick to have a business email compromise event or something like that, and that's the start of it. So, yeah, I think it's really about cyber's everyone's business now, not just the technical people that work on the networks for us. So, yeah, it's really about making it more accessible for everyone to be more mindful of.
Thank you so much. It's a jungle, isn't it? It's a jungle.
Sure is.
I think it's terrible the way human behaviour, most of us, I think, are honest, hardworking. We try and follow appropriate pathways through our life, and then we have people that seem to find great joy and profit from just making these sorts of business.
Absolutely.
It's just terrible. But in reality, we have to accept it. So we're so grateful that we have you there, and thank you very much for taking the time to talk with me this morning. It's been very educational. Thank you so much.
Thank you.
Thanks, Dr. Luke.
Thank you. Thank you for joining me on this podcast with Dave Vosnakes and Stephanie Way. We've discussed this very important subject of cybercrime. Please note that if you are unlucky enough to be subject to a cyber attack, it is mandatory to report this to the government. The Office of the Australian Information Commissioner, the OAIC, is the office we must report this to through reportscyber.gov. Also, please note that there is a Stay Secure campaign that the government has run, highlighting the need for multi-factor authentication for our medical data, highlighting that we should use strong phrases for our passwords, and insisting on software updates with our IT staff. I do hope this has been helpful. Please join us for the next episode. We'll have a new guest to discuss another very interesting subject. During the podcast series, we will be covering a wide range of topics across many specialty interests. The discussions aren't intended as specific medical advice for patients, but as general information only, and do reflect the opinions of the guests interviewed. Requests for new topics to be reviewed and comments about the conversation you've listened to are welcomed and may be emailed to manager@gihealth.com.au. Thank you.